Hello. Good afternoon, everyone. I think Gwali sir has joined.
Yes, ma'am. Yes. Yes. Am I audible? Am I audible?
Yes, yes, sir.
Okay.
Over to you, Krishna.
How many
Good
present?
afternoon. Am I audible to everyone?
Yes, yes.
Yes, yes.
Thank you. Before starting, I request all the participants to kindly turn on their cameras. Good afternoon, everyone. I am Visa Jain, and it is my honor to welcome our chair, co-chair, and participants. The IBA CRE Conference 2025, organized by the Amity Institute of Behavioral and Allied Sciences, Amity University, Lucknow campus. It is an international interdisciplinary conference that brings together researchers, academicians, and practitioners to explore innovative approaches in psychology, healthcare, and community well-being. This year's theme, Community Health, an Integrative Approach, emphasizes the importance of holistic healthcare, bridging biomedical sciences with social, psychological, and behavioral interventions to promote sustainable community-based mental health initiatives. Today, we have with us as chairperson, Professor Dr. Gautam Gauli, a distinguished psychologist, academician, and researchers with over 32 years of experience in clinical counseling and positive psychology. Dr. Gauli is the Deputy Pro Vice Chancellor of Amity University, Mumbai, Professor and Director of the Amity Institute of Behavioral and Allied Sciences, and Dean of Student Welfare at Amity University, Mumbai. Previously, he was a professor and director of the Amity Institute of Behavioral and Allied Sciences and Dean of Student Welfare at Amity University, Mumbai. And he was also the head at the University of Mumbai's Department of Applied Psychology and Counseling Center and ex-honorary director of ICSSR, Western Regional Center, MHRD, Government of India. He has also served as a psychologist in the Ministry of Labour, Government of India, and an additional lecturer at the All India Institute of Physical Medicine and Rehabilitation, Ministry of Health, Government of India. Dr. Gauli has presented research papers and chaired sessions at prestigious international conferences, including the British Psychological Society's Silver Jubilee Conference in London, 2001, the NCDA Centenary Conference in Boston, USA, 2013, and an invited talk at University College London 2015. His publications include notable works such as Vocational Rehabilitation of Persons with Disabilities 2012, Self-Concept, Impact of Caste and Gender 2005, Social Injustice, Psychological Intervention 2008, and many more. He has also edited 5 books and successfully guided 15 PhD scholars so far. Dr. Gauli has held key leadership roles, including former Senate member and committee chair at the University of Mumbai, former president of Marathi Manasashtra Parishad, member of the Planning Commission's 11th Five-Year Plan 2007 to 2012. Dr. Gauli's invaluable contributions, leadership roles, and commitment to psychology have made a lasting impact on academia, research, and applied psychology. It is a privilege to have you with us, sir. Now, I am delighted to introduce our co-chair for today, Professor Dr. Neelam Bansal, a distinguished academician and researcher in the field of education, rehabilitation sciences. With an extensive career in academia, she has made remarkable contributions through research, publications, and policy work. Am I still audible to everyone?
Yes, yes, yes. Please go ahead.
With numerous national and international presentations to her credit in the field of disability, rehabilitation, and inclusion. A leader in her field, Dr. Bansal's dedication and impact continue to shape the future of special education. Over to you, ma'am.
Thank you, Ms. Krishleen. Firstly, I have to say good evening to everyone. It is my great pleasure and honor that I extend a warm welcome to our esteemed guest, distinguished speaker, Professor Dr. J.S. Gwali sir from MET University, Mumbai. We are truly grateful for your time and contribution, sir. It is my great pleasure to welcome you all to the International Conference, Community Health and Integrative Approach at MET University, Uttar Pradesh, Lucknow campus. We are honored to have such an distinguished gathering of the audience. I will not take more time because we have to complete the session within the time. So thank you, everyone. Over to you, Krishleen Beta.
All right, before we start, for clarity of the audience and the participants and everyone present here, standardized instructions for the presentation are as follows. Participants, kindly make a note. The participants will have a total of 8 minutes to present. This will be followed by queries and discussions on their respective work. A bell would ring after a lapse of 7 minutes, and we will, from our side, we will unmute and also remind you that 7 minutes is over, and you are requested to wind up your work in the next 1 minute. Also, this is for everyone's clarity that this online presentation will not have any CRE credit points. All right. Now, our first presentation for the day is titled The Illumination and Evolution of Mind, an Integrative Approach to Indian Psychology. I request Ms. Kritika Mishra to kindly turn on the camera, and I will hand over to her now. Please share your Ms. Kritika Mishra.
Yeah. Good afternoon,
Share your
everyone.
slides also.
Yeah. Ma'am, am I audible?
Yes, you are audible.
Okay.
Okay.
I have.
PPT is visible, Beta.
Yeah. Okay. Can I start?
Sure.
Yeah. Good afternoon, everyone. Respected Honorable Chairperson and co-chair members, professors, and my fellow presenters. My name is Kritika Mishra. I am pursuing PhD under the guidance of Dr. N.L. Mishra at Chitrakoot University. The title of a paper presentation is Illumination and Evolution of Mind and Integrative Approach to Indian Psychology. Indian psychology is based upon the ontology where the nature of the mind is consciousness and it has a spiritual orientation and holistic approach based upon the framework of consciousness, mind, body. Consciousness is subjective awareness of inward and outward reality. So in Vedanta, Brahman is considered as the supreme consciousness, which is self-manifested, eternal, and consciousness, when limited by the modifications of mind, is called jiva. This illuminates a mind and body's function, and it is categorized as transactional approach, which is psychophysical, and transcendental approach, which is psychospiritual. The concept of mind in Vedanta is that the mind has a tendency to flow out, and it has three parts: buddhi, manas, and ahankar. The mind flows out, makes contact with the object, and the buddhi gets modified, giving rise to vrittis, which is processed by manas and ahankar. And the ahankar gives the discriminative or creates attachment, which is called the false self or the empirical self. The buddhi also has predetermined vasanas, vrittis, and sanskars as the tendency, and that also affects the process of perception. Now, the relevant review of literature for this paper were psychosynthesis, studies on consciousness and its type. Psychosynthesis was inspired by Bhagavad Gita as well. Phenomenological dimensions of altered states of consciousness, and the quantum physics research on implicate order of undivided universe, which is similar to the concept of Brahman or the supreme consciousness. A content analysis was conducted on 20 global studies, which have ascertained that there are positive mental states and altered states of consciousness created, usually as the outcomes of practicing religion and spirituality. Indian psychology, in the light of Upanishads, which have taken Taittiriya, Chandogya, Isha Upanishad, and it has been interpreted by the books by Dr. Rao and Dr. Sinha in Indian psychology, they consider it and they see it in the light of mental evolution. So I'll be showing both of them. So the first is the content analysis of the global studies, where there are positive mental states which have been ascertained by the religious and spiritual practices. Here, God is seen as an archetype which encourages goodwill, and it aspires one to achieve the higher versions of true self. That leads to positive states of mind, such as resilience, altruism, forgiveness, compassion, warmth, love, gratitude. Community religious rituals also help in social harmony and creating social bonds through de-individuation. These states have also been equated to coping mechanism. These are affirmed and also applied by practicing psychologists because they encourage value-based approach, very inclusive of diverse human experiences as well. Altered states of consciousness, the studies have, there are neurological studies which show that there is a reduce in the right parietal lobe, which reduces the sensation of empirical self. That leads to higher cognitive states of bliss, interconnectedness, and also the positive states of selflessness and forgiveness. These have been attributed to self-control as psychobiological causes. And altered states of consciousness also have therapeutic effects, which are the founding roots of psychoanalysis and mesmerism. It has been associated with self-realization and the positive mental states, which are attained through developing sacred qualities, help to sustain that. Now I'll study the same thing through the Vedanta or the three Upanishads. So Taittiriya Upanishad sees it as the connection of transcendental to the transactional. The Taittiriya Upanishad says that the consciousness is the true self and it is embodied in 5 koshas. The first, the external one, is the annamaya, food sheath, which is gross body. It is the farthest away from the pure consciousness, and it focuses on outward reality. Then there's pranamaya kosha, vital forces, manomaya kosha, the mind, mental sheath, which navigates between the outward and inward subjective reality. Vijnanmaya kosh, the buddhi, intelligence, which acquires the wisdom. And the last is the anandamaya kosha, the blissful sheath, closest to the pure consciousness, and it experiences pure bliss and joy. So when we see the structure of the Panch Koshas, it is immersive, it is subjective, and we can understand why it is inward. It journeys from outward to inward, and each sheath is permeated by the other sheaths. So we go from Annamaya to Anandamaya. And this is also regulated through religious and spiritual practices. So we can understand altered states of consciousness as intelligence sheath or the Vijnanmaya kosha, which is wholly permeated by the blissful sheath, and it leads to awareness. And then this intelligence sheath permeates the mind or the mental sheath, and mind experiences positive mental states as a reflex. This can be further understood by Isha.
Only
Yeah.
1 minute is remaining. Kindly wind up quickly.
Sure, sure. So Isha and Chandogya Upanishad calls it evolution of mind. The perception is shaped according to transcendence. It develops positive vrittis that converts a lower consciousness or the egoic self. The buddhi attains higher states of consciousness, and the sacred and positive mental states like benevolence and tranquility maintain the state. So this, according to Advaita, is called Jiva Sakshan because the limited and unlimited selves difference is understood, and one ceases to cross this. The relevance of this approach is to, first of all, live in a self-awareness form. It can help one understand the depth of the psycho-spiritual benefits of popular alternative practices like meditation and spiritual counseling. It integrates religious and spiritual fraternities with psychologists, and it aims towards holistic well-being. And it also encourages interconnected transformation from individual to the collective wellness and growth. So with this, I would like to conclude. Thank you everyone for the opportunity and your time, and my best wishes to the upcoming presenters. Thank you.
Okay.
Thank you very much, Ms. Kritika. That was very insightful. Thank you so much.
Thank you.
Now I request our next presenter. My apologies. Before requesting our next presenter, Professor Dr. Gawali sir, would you like to take forward and go ahead with the questions?
The provision of asking questions. Okay. So from audience, I think if audience can ask 1 or 2 questions. Okay. Am I audible?
Yes, sir.
Sir, it is not mandatory. Actually, if you want, you can ask some questions.
Okay, because see,
You can keep a presentation
just
on.
one clarity from Kritika,
Yes, sir.
which was a good attempt to understand Indian psychology. But Indian psychology is not restricted to only one religion.
No, no, no.
Indian psychology has many. We have
Yeah.
the cultural, multi-religious concept here.
Yes, yes.
Okay, that also should have been added. So it would have become more what do you call it? More innovative and more important in understanding human behavior.
Yes, sir. Actually, I just took Vedanta, and in the paper also I've mentioned that I'm only taking Vedanta.
But there are many other variables.
Yeah, yes. I have taken it in my thesis, definitely. I've just taken a small.
More of a religious psychology rather than, like, say, it's like a Hindu psychology rather than Indian psychology.
Yeah, that's a dimension of it, sir. So the Vedanta takes the spiritual as well. So I just took that. Yeah.
Thank you. Yeah. Okay, you can invite the next person.
Yeah. Thank you, sir.
Thank you, sir. Thank you, Ms. Kritika. Now, with the title of our next presentation is Unveiling the Dynamics, a phenomenological study of teacher-student interactions based on high school teachers' experiences. I request Ms. Shivangi Gupta to please take over from here and also share her presentation.
Yes. Am I audible?
Yes, you are
Yes.
audible.
Okay, I'll just present my PPT. So, is the PPT visible too?
Yes, it is visible.
Okay, okay. Okay, so I'll just start. Okay, so a very warm good afternoon to one and all present here. I, on behalf of my research group, would like to talk about a research that is unveiling the dynamics, a phenomenological study of student-teacher interaction based on teachers' experience. So, as we know, India has a vast number of teachers, that is, 90, exceeding 95 million, and their interactions significantly shape classrooms dynamics and behavior of students as well as teachers. According to previous researchers, conflictual relationship between teachers and students were linked to higher level of emotional exhaustion. But teachers who reported close relationship with students reported better level of personal accomplishment across the academic year. So the aim of our research was to explore the perspective of teachers on student-teacher interaction based on various factors such as underperformance of students within classroom engagement, relational support, autonomy support, and emotional interaction. As we saw previous researchers, we found that there are very few researchers which take perspective of teachers on the student-teacher interaction, especially post-COVID. So the theoretical framework of our research is embedded in Pianta's theory that states that the student's engagement does not solely depend on the child's characteristics. Rather, these are embedded in effective classroom interactions and relationship. He laid out factors such as relational support, emotional interaction, autonomy support within classroom engagement, and under performance of students that affect students and their engagement in classroom. Pianta also states that student-teacher relationship formation framework explains that these relationships are influenced by the beliefs and expectations that teachers and students hold about themselves, about each other, and the nature of their interaction. So, the behavioral exchanges between them play a crucial role in shaping their experiences and reinforcing or altering their beliefs. So, to explore the teacher's perspective, we uh, we took phenomenological approach and qualitative approach. So the study falls under the constructivist paradigm as we attempt to capture the perspective and interpretation that teachers attach to their interaction with students based on factors such as underperformance, classroom engagement, relational support, autonomy support, and emotional interaction. We collected the data using semi-structured interview from 15 school teachers teaching in Delhi NCR schools from any grade to 6 to 12. So purposive sampling was used to select the sample. And for analysis, we used Brown and Clark analysis, thematic analysis. So from our analysis, we found out the result 5 themes, which are as follows. First is policy adaptations and holistic development. So policy adaptation and holistic development implies the teacher's perspective on policy changes such as NEP, that is new education policy, and how these policies have affected the development of students and their classroom environment. It also highlights how institutional policies have burdened teachers with overwhelming responsibilities, which are also negatively affecting students. So one of the example is one of the teachers told that the school has made the institutional policy that if any student doesn't complete their homework or any work, it's teacher's responsibility to make them finish the homework or the work. So it also costs a very big amount of mental health that teachers suffer from exhaustion, and which also is seen in their relationship with the students, their interaction with students. So the policy changes have also positive effects and as well as negative effects, such as the activities that are now introduced in policy changes, such as going out in the environment and learning practical things, have led out the foundation for cultural humility as well. Moving on to our next theme, that is heterogeneity in a teacher's experience. It implies the differences between teachers' experience explained by them. So we found out that the teachers who are more experienced, such as in their 10th year of teaching or 11th year of teaching, they don't really see teaching as an exhausting job. Now they have adapted to the environment, and now they just feel that it is a day-to-day regular activity. But rather for the teachers who are in their first year or second year, it is very exhaustive job for them, especially when it comes to dealing with the parents of the teachers and interacting with the students on a personal level, especially when they have done something mischievous. So how to handle that situation? Moving on to our next theme, that is challenges faced by teachers in classroom. It is especially in the field that creating inclusivity in the classroom. If they see someone getting bullied based on their race, culture, ethnicity, they cannot scold the bullies, but at the same time they have to support the victim, like the student who is being bullied. So there is a great amount of effort that goes in to create an environment, a safe environment where the bullies can also learn, because they're also children at the same time, and the victim can also feel safe in expressing themselves. So it takes a great amount of ability to make an inclusive environment. And teachers also referred the mindset of the parents as a hindrance or a stressor between, because most of the things are learned by children from their parents, because they hold a certain mindset. So they have to
1 minute remaining. Sorry to interrupt. 1 minute
yes,
remaining.
yes. So they have to take it into consideration as well. So another theme is disciplinary approaches. Teachers take a friendly approach over punishment so that they can create a safe environment where students can accept and change their mistakes rather than being feared that, oh, we'll get scolded now. And the last theme is personalized mentoring for students' needs. So teachers try to, you know, make the curriculum as easy as possible for the children, but what they want is the support from the parents, that they also take a step forward and build a environment in which students can learn and teachers can also help support them in learning, and it is not exhaustible for the teachers as well at the same time. So the future implications of the study is it can be done on a large scale to explore various outcomes such as cultural humility and differences in interaction with older teachers and new teachers, and the school can use these data to reform the institutional guidelines by considering teachers' experience and effect of these guidelines on teachers. So with this, I would like to wrap up my presentation. Thank you for all for patiently listening to the presentation.
Thank you so much, Shivangi. Now, the next presentation for us would be the role of perceived creativity, cognitive flexibility, and sustained attention in predicting smartphone use among university students, Kolkata. May I request Jyoti Sethia to please share the PPT, and I request Jyoti Sethia to kindly start with the presentation. Jyoti Sethia, are you here? Since Jyoti Sethia is not here with us, now we will move to the next presentation titled Social Media Deteriorating Mental Health. I request Vikas Dhanda to please share the presentation and start with the presentation. Vikas, are you here? Yes.
Yes, ma'am. Good afternoon, everyone present here. I am Vikas from Om Sterling Global University, Hisar. I am presenting on the topic Social Media Deteriorating Mental Health. The rapid rise of social media platforms such as Facebook, Instagram, and Twitter has totally revolutionized the style of communication and interaction among individuals. In this study, I investigate the relationship between social media uses and mental health on 400 adolescents of various socio-economic backgrounds from Hisar district of Haryana. The data was collected using quantitative standardized tests relating to social media usage patterns, engagement with content, and self-reported measures of psychological well-being. The findings reveals a significant negative correlations between social media usage, both in terms of hours and the years of engagement and mental health. Coming to the introduction, social media, as we all know, are the digital platforms which allow their users to create and share and interact with content and becomes a source to communicate with others. The apps broadly used like WhatsApp, Facebook, TikTok are examples of such digital platforms. Social media use is rising day by day. Especially adolescents are engaging with these platforms on a large scale. On one hand, social media helps them to connect with their friends. On the other hand, there are some negative impacts of social media platforms on their mental and psychological well-being. Coming to mental health is not merely the absence of any mental illness, but it includes an individual's emotional, psychological, and social well-being with satisfactory psychological functioning. From the perspective of positive psychology, the ability of an individual to enjoy life, maintain balance among different life activities, and develop psychological resilience indicates towards good mental health. According to World Health Organization, mental health is the presence of subjective well-being, self-efficacy, autonomy, competence, intergenerational dependence, and the realization of one's intellectual and emotional potential. Coming to the literature review, many researches has been conducted in last decade on the topic social media and mental health. Penna et al. In 2019 explored both the positive and negative effects of social media on adolescents' mental health. On positive side, they found social media helping adolescents to connect with their peers and their other friends and provide a sense of community. On the other hand, they also indicates towards the negative effects of cyberbullying, social comparison, and addiction, which may lead to increased anxiety, depression, and low self-esteem. Similarly, McCreighton in 2017 called social media a double-edged sword. According to them, social media offers much opportunities for connection, self-expression, and emotional support, but they also noted its potential to adversely affect mental health issues, especially in the face of cyberbullying, harmful social comparison, or addictive usage pattern. Similarly, in 2014, Pentic explored the role of online social networking in relation with mental health of adolescents and young adults. This study also acknowledged the similar aspects as shown by other previous studies, focusing on both positive and negative impacts. The research emphasized that the quality of online interactions impacts more on shaping mental health outcomes than the sheer quantity of social media use. The research methodology that was used in this study is like this. In this study, quantitative methods approach combining questionnaires and standard tests to comprehensively explore the relationship between social media uses and mental health among adolescents was used. Hypothesis is the null hypothesis was such that there will be no relationship between social media uses and mental health. And on the other hand, alternate hypothesis was there will be significant relationship between social media and mental health of adolescents. Data collection. Quantitative data was collected from the students of different schools of Hisar district, different standard tests assessing participants' social media users patterns, time spent on platforms, engagement with different type of content, and self-reported mental health questionnaires were used. Sample size, as already discussed, 400 adolescents, 200 girls and 200 boys were chosen for the current study. Statistical analysis was done using descriptive statistical tools. The quantitative analysis examined correlations between social media uses and the mental health. The tools that were used to collect data are as such. The first tool that is social media uses questionnaire for adolescents, which was constructed by Mr. Navneet Bhadia. And the second tool that is PGI Health Questionnaire, which is developed by SK Verma, NNV, and D. Prasad Chandigarh, are used. The statistical analysis of the data gives flowing results, which indicates that social media was strongly linked with mental health. Specifically, social media uses in hours had a moderate positive correlation with mental health score, indicating
Sorry
that.
to interrupt. 1 minute remaining. Kindly wind up.
Okay, ma'am. Indicates that more time spent on social media is associated with poor mental health. Similarly, social media usage in years also showed a moderate positive correlation with mental health, suggesting that individuals who have been using social media for longer periods tend to report worse mental health outcomes. Overall, social media usage, both in terms of hours and years, had strong positive correlation with mental health, further supporting the idea that increased and prolonged social media engagement is linked with poorer mental health. To conclude, we can say that the greater the social media engagement, both in terms of time spent and duration of use, the worse will be the mental health. The strong correlation reflects a significant concern regarding the impact of social media on the mental health, particularly in increasing stress and negative mood states resulting from prolonged usage. So there is a need for further research to intervene the negative effects of social media on mental health. These are the references. Thank you very much for listening me patiently. Thank you.
Thank you. Thank you so much, Vikas, for that enriching presentation. Thank you. Now, I request Simsima Hazarika to please share the screen with us. She will be presenting on effects of loneliness on depression among elderly people. Simsima Hazarika, are you here with us?
Yes.
Yes. Kindly share your screen.
Actually, I am getting a message that host isn't allowing multiple presenters sharing for this meeting.
Okay, okay. Vikas, Mr. Vikas, please make sure that you are no more sharing your screen.
Okay, ma'am. Sorry.
Yeah, no problem.
Is it visible?
Yes, it is visible.
Okay. Respected chairperson, co-chairperson, and all the participants out here, the topic of my paper for this international conference is effect of loneliness on depression among elderly people. So going with the introduction, it is the feelings of loneliness which is associated with inadequate psychological adaptation and dissatisfaction with social and family relationships. And if loneliness goes untreated, it can have negative impacts on both emotions and cognitive functions. There can be several reasons of being lonely, like physical restriction, chronic health problem, self-perceived poor mental health, and decline in physical or mental well-being. The rationale of the people, knowing the loneliness and depression experienced by elderly people will help to identify whether or not there are any differences and relationship between them, and if so, how much of a difference and relationship there is. It will also provide a thorough understanding of elderly people's mental health. Understanding how loneliness affects depression in the early is essential to improve their mental health. Significance of the paper. The results of the study will be beneficial for professional educators, counselors, parents, and those individuals who are interested in gaining insight. Psychologists may be able to support successful learning and healthy growth by offering resources that cater to the social, behavioral, mental, and cognitive requirements of the elderly people. The objectives of the paper: to evaluate the disparity in loneliness between male and female elderly people, to evaluate the disparity in depression between male and female elderly people, to explore the relationship between loneliness and depression in male elderly people and female elderly people. Hypothesis: there will be a significant difference in loneliness experienced by male and female elderly people, significant difference in depression between male and female elderly people. There will be a significant relationship between loneliness and depression among male elderly people as well as female elderly people. The research methodology, it was a correlational research. The independent variable was loneliness and dependent was depression. It was done in Kamrup Metropolitan District, Assam, from the age range of 65 to 75 years. It consisted of 60 elderly people, 30 males and 30 females. It was a purposive sampling. Criteria of inclusion was the age range 65 to 75 years of both male and female from Kamrup Metropolitan District, excluded below 65 years and above 75 years, and those elderly people who were outside Kamrup Metropolitan District. Description of the tools, this UCLA loneliness scale by Russell, Pavlov, and Ferguson was used. It has 20 statement and geriatric depression scale, which had 15 items. It was used. Then the ethical consideration, it was taken into thing that the receive a comprehensive description of the goal of the study, and after that questionnaires were given to the participant and confidentiality of each participant was preserved. Operational definition: in the study, loneliness was defined as a sense of emptiness experienced by elderly. Depression as the experience of sadness in older elderly people between the age group of 65 to 75 years of age was considered as the elderly people. Procedure: the questionnaires and data collection process were explained to the participant, and then the questionnaires was given. And after that, the researcher gave the questionnaire to the participant, and then at the last, they were thanked for their cooperation. Statistical tests, a significant difference of t-test and correlation was used. Resultant discussion: in this table, we can see that the of the loneliness of male and female. The male had higher mean than female. T was not significant at both the level. This is a graphical representation. Since T was not significant, therefore the hypothesis there will be significant difference in loneliness experienced by male and female was not accepted. This table of depression here, we can see male's mean was higher than the female and the T was not significant at both the level. The graphical representation. Since the hypothesis was t-test was not significant, therefore the hypothesis was not accepted. This is the correlation. It has a positive correlation, but it was not significant at both the level. So therefore the hypothesis was not accepted. This is the correlation of female. Here also it has a positive correlation between depression and loneliness, but it was not significant. So therefore the hypothesis there will be significant relationship was not accepted. Major findings: there was no significant difference in loneliness of male and female elderly people. In loneliness, mean of male was higher than the mean of female. There was no significant difference in depression of male and female elderly people. In depression, the mean of male, which was more than the mean of female. There was positive correlation between loneliness and depression in male elderly people. There was no significant relationship between loneliness and depression of male elderly people. Positive correlation between loneliness and depression in female elderly people. There was no significant relationship between loneliness and depression of female elderly people. So in conclusion, we can say a large portion of the elderly population worldwide experiences social isolation, loneliness, which can diminish their lifespan and adversely affect their mental and physical health as well as their overall well-being. Loneliness and depression are believed to have a negative impact on the overall well-being of elderly individuals. While there are no established standards for identifying loneliness in the early, as everyone experiences it differently, it is often associated with symptoms such as weight gain, disturbances of sleep, decreased enjoyment in social networking, and reduced interest in social activities. So if more time is given spent with the elderly people in the family, maybe they can help to reduce their loneliness, which will also the depression will not increase in such kind of elderly people. These are some of my references. Thank you.
Thank you very much, Simsima Hazarika. Your presentation has provided us with deeper understanding on the topic. Thank you so much. Now, our next presenter's title is Psychosocial Interventions for Managing Depression in Geriatric Populations. I request Vanya Bhargava to kindly share her screen with us and start with the presentation.
Hello, I'll just be presenting.
Vanya,
Vanya has left the meeting. It might be a network problem. Let's move to the next presenter until Vanya joins back. I request Sakshi Sharma to please share her screen. The title is Exploring the Influence of Spiritual Well-Being on Self-Perceived Health Among Incarcerated Individuals. Is Sakshi with us? I don't think Sakshi is with us right now. Okay, I request the next presenter, Neelam Bogda. Neelam, are you here with us?
Yes.
Yes, all right. Neelam's topic for presentation, the title is Post-Traumatic.
Sorry, I was part, but while I was presenting, I got logged out.
Vanya, is it okay if we start with Neelam's presentation and we'll move to you next?
Yeah, that works.
After Neelam's work is done, we will move to yours. All right. Neelam, kindly share your screen. The
Please
title
give
of,
me
yeah, no problem. The title of Neelam's presentation is Post-Traumatic Growth in Kidney Transplant Recipients, the Role of Self-Efficacy.
I'm sorry, it was sudden, so
No problem. You can take a few seconds.
thank you so much.
As Neelam is preparing to share her presentation with us, to the other participants, I request that you all please be ready with your presentations, because if someone, because of network issues or any technical glitch, is not there with us, we will move to the next presentation immediately. All right, Neelam has shared her screen with us. Neelam, you may begin.
I'm sorry. Are you able to see the entire screen or my presentation?
We are only able to see you as of now.
Okay.
Do you need a few minutes to figure this out?
Yes, I need to figure this out because my
Vanya,
laptop died, so I borrowed someone else's, so I'm not able to figure
all
out.
right, all right. Vanya, is it okay if you present now?
Yeah. I'll just share my screen.
All right, Vanya. So we will have Vanya presenting for us. Very sorry for the network issues and the glitches.
Is my screen visible to everyone?
Yes, you are audible and also your screen is visible.
Mhm. Right. Okay, so I'm Vanya Bhargav, a second year student from Manipal University, Jaipur, and I've written an abstract over the topic psychosocial interventions for managing depression in geriatric populations. So, I will be discussing the growing concern of depression in geriatric populations and how psychosocial interventions can effectively manage this issue. As the world's population ages rapidly, mental health challenges among older adults are becoming more prevalent. In 2020, 1 billion people aged 60 or above, or a number that is expected to be doubled by 2050. This demographic shift highlights the urgent need for effective mental health interventions. Aging brings physical and social challenges, including chronic pain, diminished mobility, and cognitive decline. These issues, along with financial instability, bereavement, and retirement, increase psychological distress and likelihood of depression. Additionally, loneliness and social isolation, affecting nearly 1 in 4 older adults, further contribute to the crisis. Many also face ageism, which negatively impacts their mental well being. Given these risks, it is crucial to explore effective treatment approaches beyond pharmacological solutions. So, theoretical understandings of psychological interventions. Two key psychological interventions that have proven effective in managing late life depression include problem-solving therapy (PST) and cognitive behavioral therapy (CBT). A problem-solving therapy (PST) is a structured skill-based approach that enhances older adults' ability to identify and solve real-life problems. It fosters adaptive coping mechanisms, decision-making skills, and a sense of control, particularly beneficial for those with cognitive decline. CBT is also a well established method that targets maladaptive thought patterns and behaviors, helping individuals reframe negative beliefs. It effectively addresses common age related concerns such as loneliness, grief, and anxiety. Both therapies provide long term benefits and reduce reliance on medication, making them safer alternatives for older adults. The abstract is based off of certain research findings. Several studies highlight the effectiveness of these interventions. Few of these studies include systematic review in international psychogeriatrics analyzed 14 randomized controlled trials showing that non-pharmacological interventions including psychotherapy and exercise programs significantly reduce depressive symptoms and enhance quality of life. Another study, psychosocial treatment options for major depressive disorders in older adults, emphasize the benefits of CBT and PST and interpersonal therapy, underscoring the importance of tailoring interventions to individuals' needs. Meta analysis confirms that PST effectively reduces short term depression symptoms, particularly for those with cognitive impairment, while CBT provides emotional resilience and stability. The following two slides includes the abstract that has been drafted over the topic. Shift towards the aging population in the world has brought an increased awareness to the unique mental health challenges faced by the geriatric populations. The most prevalent mental health conditions among older adults are depression and anxiety, often exacerbated by age related factors such as chronic illness, social isolation, and significant life changes. This review deems to explain the emergence of psychosocial interventions in modern society as a vital non-pharmacological approaches to addressing these mental health concerns. Interventions like PST, that is problem solving therapy, and CBT, that is cognitive behavioral therapy, have shown effectiveness in treating LLD, that is late life depression. Using them together have a synergistic effects. PST offers a comprehensive framework for managing depression in older adults while emphasizing practical problem solving techniques, whereas cognitive behavioral therapy CBT targets dysfunctional thought patterns. Meta-analysis of randomized controlled trials of participants over the age of 60 showed problem-solving therapy reduced short-term clinical rated depressive symptoms. Furthermore, several findings indicate that active skill-based psychotherapy, such as PST and CBT, may be more beneficial for late-life depression than supportive non-directive counseling. PST may be especially important for compensating for the skill loss linked to late life depression, such as cases of disability and cognitive impairment, particularly executive dysfunctions. When it comes to dealing with late life depression, cognitive behavioral therapy and problem solving therapy are critical since they are non pharmacological. They offer safer and more effective alternatives to traditional treatments, particularly for elderly who may be more vulnerable to bad medication reactions. PST emphasis on practical problem solving and CBT's emphasis on modifying maladaptive thought patterns provide complementary tools for addressing the unique psychological and situational issues that older people encounter. The aging population henceforth faces dire mental health challenges like depression and anxiety. Non pharmacological interventions like CBT and PST effectively address these issues, offering complementary approaches to manage psychological and situational difficulties in older adults. As we face a rapidly aging global population, addressing geriatric depression is critical. Cognitive behavioral therapy and problem solving therapy have emerged as essential non pharmacological approaches that provide a holistic, long term solution. These interventions enhance psychological resilience, promote independence, and reduce reliance on medication, ultimately improving the overall well being of older individuals. Moving forward, integrating these therapies into geriatric healthcare can significantly impact the quality of life for older adults worldwide. Thank you, and I appreciate for your time and attention.
Thank you very much, Vanya. We really appreciate your presentation. Now, may I request Neelam Gogda to kindly share her screen and go ahead with her presentation.
Hey, can you see my screen or just the presentation?
We can see the presentation. We can see the title of your presentation.
Okay. So suddenly started updating. So yeah, you can only see the presentation, right?
Yeah, we can only see the presentation now. You can start.
Okay. So good afternoon, everyone. I am Neelam Gogda, and today I'll be presenting my research on post-traumatic growth in kidney transplant recipients, the role of self-efficacy. Now, this study explores the self-efficacy, how self-efficacy influences psychological growth after a kidney transplantation. So, kidney transplantation is a life-saving procedure, but it also comes with various psychological challenges. According to many researchers, many recipients experience stress, anxiety, uh, emotional distress. However, some individuals they experience post-traumatic growth, which is according to Tedeschi and Calhoun, who coined this term. Post-traumatic growth is positive psychological change after trauma, and self-efficacy, according to Bandura, which is the belief in one's ability to cope with challenges. It plays an important role in improving people's post-traumatic growth, how they deal with challenges. So this study examines how self-efficacy contributes to PTG in kidney transplant recipients. So PTZ has been studied traditionally in the context of extreme trauma, including natural disasters, bereavement. But recently now it has been recognized in medical population. It is studied as medical trauma, including in kidney transplant patients. So Tedeschi and Calhoun's PTG theory explains how individuals grow psychologically after trauma. And additionally, Bandura's theory of self-efficacy shows that people with higher self-efficacy are more resilient in the face of challenges when they face difficult situations in their life. So after reviewing the literature, these are the objectives of our study. The main objective was to examine the relationship between self-efficacy and post-traumatic growth in kidney transplant recipients, specifically to determine the correlation between these variables and to assess whether self-efficacy significantly predicts post-traumatic growth, and also to examine gender differences in these variables between male and female kidney transplant recipients. And based on the objectives, these are the research hypotheses. Now, research methodology. So initially, I approached more than 65 kidney transplant recipients, but after reviewing the inclusion criteria, exclusion criteria, 50 kidney transplant recipients were selected, equally divided by gender, male and female. And to select them, I used purposive sampling method, and they were selected from the hospitals and the community centers from Gujarat. So these are the inclusion and exclusion criteria. Now, data collection and procedure. So first, the research was approved by the Institutional Ethics Committee, IC, of Gujarat University, and then the official permissions were taken from the hospitals and community centers for data collection. And then participants were informed about the purpose of the study, their role in the study, and they were given a consent form. After obtaining their consent, they were asked to fill the questionnaires, which I used for my study is post-traumatic growth inventory, which are given by the founder of Post-Traumatic Growth, Tedeschi and Calhoun, 1996. And other tool is Self-Efficacy Scale by Singh and Narayan, which is widely used in Indian population. And to analyze the data, I used Pearson's correlation, regression analysis, independent t-test, and descriptive statistics. So now let's talk about the result and discussion. Okay, so descriptive statistics showed that self-efficacy score was 88.20 and the mean PTG score was 77.96, which indicated that participants, kidney transplant recipients, they moderate to high level of self-efficacy and post-traumatic growth, both. And the Pearson's correlation revealed that there is a positive significant correlation between self-efficacy and post-traumatic growth among kidney transplant recipients. Now, this correlation was moderate in strength, which suggested that why self-efficacy contributes to post-traumatic growth. And this research, it is moderate, but it aligns with previous researches on various medical populations, including cancer survivors, pediatric cancer survivors, born patients, and pandemic survivors, and other kidney transplant recipients. These studies suggest that individuals with higher self-efficacy, they are more likely to experience post-traumatic growth as they engage in coping strategies, and they maintain a sense of control over their circumstances. Regression analysis for my study revealed that while self-efficacy is an important predictor, other factors also contribute to PTG. Why? Because there was low variance in PTG, which was only 9.3%. Now, similar findings have been observed in caregivers of children with developmental disabilities and in studies on refugees, where higher self-efficacy was associated with greater psychological growth after enduring difficult life events by the patients. Now, this also supports the idea that self-efficacy is a universal factor across different trauma-exposed survivors populations, medical or other population. Then my t-test analysis revealed that male participants, male kidney transplant recipients, they scored significantly higher level of self-efficacy and post-traumatic growth compared to the female. Now, this finding is contradicting the previous research also done by the founder.
Sorry to interrupt. 1 minute remaining. Kindly wind up your work.
Sure. Which has generally suggested that women tend to report higher level of post-traumatic growth in various trauma-related contexts, like among survivors of life-threatening illnesses or other stressful life events. Now, this gender difference can be explained by societal expectations and gender roles. Women often face additional responsibilities such as caregiving duties, emotional labor, like caregiving duties, emotional labor, and societal pressures. Now, which may limit their ability to focus on personal growth after transplantation, while men may receive more encouragement to develop self-reliance and confidence, which will contribute to their higher self-efficacy scores. But there is a need of future research which can explore these gender-related influences further. To share some practical implications, including self-efficacy training in post-transplant rehabilitation may help recipients to develop confidence in managing their health and recovery, which will provide structure in education on medication adherence, lifestyle changes, and coping strategies can empower recipients to take control of their health. Mental health interventions, including simple
Kindly
counseling.
wind up. Your time is over. Please wind up. Please conclude.
Okay, I also face some limitations, and I have also provided some suggestions, which you can see. And with this, I would like to conclude my presentation, and I would like to thank all the participants, chairpersons, and AIBS, Amity University, to give me this opportunity to present my research, to share this experience. Thank you so much.
Thank you very much.
for shedding more light on the topic. Thank you so much. Now I request our next presenter, Prerna Parihar, to please be ready. Please share your screen. The title of her paper is Positive Effect of Spirituality on Students' Mental Health and Well-Being. Prerna, are you here?
Yes, yes, I am. Just a minute. Good afternoon, everyone. This is my review paper, which titled Positive Effect of Spirituality on a Student's Mental Health and Well-Being. Let's understand the problem. In today's 21st century, students find themselves with different issues that impact their mental health negatively. Depression, stress, and failures can come when one is to create a well-performed image and identity. In such type of a situation, the importance of spirituality has come to light in enhancing the mental health of the students. Here are some research from the literature review which showed a strong connection between high spirituality and improved mental health and well-being. Here are some benefits of spirituality. Research shows the tremendous result of indulging in spiritual practices on the health and overall well-being. Sometimes the results are not seen by others, but they can be felt inside. In a very scientific way, these practices shows benefit over longer times. Spirituality lowers stress, depression, and anxiety, reduces blood pressure, improves the functioning of immune system, improves the mental well-being, increases social interactions, increases longevity. Here are some spiritual practices which can be beneficial to enhance enhance the mental health and well-being of the students. These are meditation, gratitude, helping others, attention to feelings, and mindfulness. Let's conclude. Spirituality may help in nurturing a sense of awareness and well-being. It is a powerful source of improving mental health and well-being. Thank you so much.
Thank you very much, Ms. Prerna Parihar. That was an impactful presentation. Thank you so much.
Thank you.
Now, the title of our next presentation is TB and Stress, Integrating Stress Management into TB Care. I request Astha Singh to please share her screen with us. Astha, are you here? Astha, are you here with us? All right. Now that Astha is not here with us, we will move to the next presentation. Stuti Srinivas, are you here with us? Stuti Srinivas.
Yes, ma'am, I'm here.
All right. Now I request Stuti Srinivas to please present her screen with us. The title of her paper is Empathy and Burnout Levels in Behavioral Medicine Students, a Personality Perspective. I request Stuti to kindly begin.
Good afternoon, Chairperson, Co-Chairperson, all my fellow presenters. I'm Satish Srinivas, with my co-author, Team Yapika. Two of my other co-authors, Srilakshmi Menon, Arpita Rai, and my supervisor and co-author, Dr. Kamakar, are also in the meeting with us.
My paper titled Empathy and Burnout Levels in Behavior Medicine Students and Personality Perspective goes from this. Behavior medicine at this point stands at a crossroad of psychology and medicine, seeks to understand human health through an integrated lens. At its core, two powerful yet contrasting forces shape the future of our healthcare, which is empathy and burnout. Empathy, the ability to connect and understand others, is essential in both of the fields. Yet the chronic demands of training often lead to burnout among all of the healthcare professionals. This ends up having depletion in the compassion that defines these professionals. Our study, Empathy and Burnout Levels in Behavioral Medicine and Personality Perspective, that dwells into how personality influences these dynamics by drawing from Jackson's empathy framework and Ainsley's biological theory of personality. We explored whether empathy, often seen as a stable trait, is in fact shaped by the pressures of burnout. As you can see in our ROL, a common thread in these studies is that personality plays a key role in shaping both empathy and stress responses. Our research builds on this by examining whether specific personality traits act as protective factors against burnout in medicine students, or whether certain traits make them more vulnerable. The need for our study is essentially that behavioral medicine students face intense schedules, heavy coursework, and lack of sleep, leading to stress and burnout. This affects their well-being and performance, which is crucial in life-impacting fields. Our study explores how emotional stability, empathy, and burnout interact using Maslow's hierarchy to understand the student well-being.
As my fellow presenter has already established the base for us, I'll get into the method of it. Our objective is to understand the relationship between empathy, burnout, and personality in behavioral medicine students, where most of our population is largely situated around psychology and medicine background. Based on the objective, these are hypotheses that there will be a significant relationship between among emotional stability, empathy, burnout, in behavioral medicine students, and personality traits will significantly predict empathy in behavioral medicine students. They've used correlation research design using the purpose of sampling technique, where our sample size is 100 and age range is 18 to 25 years with residing in Bangalore. And we have used three standardized questionnaires for all the three variables, which is circulated among a Google form, and we're using correlation analysis and multilinear regression for our data analysis. So based on the data collected, the correlation between burnout, empathy, and emotional stability is rather statistically significant, where empathy and burnout is positively correlated, whereas emotional stability negatively correlates with burnout and empathy. Based as the this is a follow-up of the same correlation table. As you can see, there is no correlation between other personality traits except emotional stability. So we're trying to predict if emotional stability predicts empathy among the population that we are collecting. So here, based on the regression, we have multilinear regression. It's evident that emotional stability significantly predicts empathy among. However, there's a negative predictive value indicating that higher the emotional stability, lesser is the empathy level. Though it is a contradicting point of view, there are certain studies that indicate such relation. Where a study in 2020 ideates that there is a significant relation between empathy and neuroticism. However, it doesn't really say the direction of significance. So our potential understanding of the possibilities of such prediction is that higher emotional stability leads to lesser empathy, largely because they see problems as dissolvable and rather problems distinct from the individual. And people who experience higher empathy are more vulnerable because they see themselves in a shared vulnerability space, thereby becoming difficult for them to be stable, or rather are seen as more neurotic.
Building upon what the presenter has spoken about, the recommendations that we look forward in the study exploring the cross-cultural studies, and our studies limited to one area of residence, Bangalore. As we know, India is a diverse country with diverse cultures. So we are very interested to see how cross-cultural studies can be conducted beyond Bangalore, beyond the state of Karnataka. Also using the same thing, building upon whether universal versus culture-specific behavioral trends are similar or there are any differences between them. And also, apart from emotional stability, we also want to check how empathy, emotional stability, and burnout is impacted in competence in this particular fields by these professions, and understanding how behavioral dynamics in the students affect their burnout, their empathy, and their emotions in general. And because our study is limited to student population of these two genres, we want to see how the professionals view whether there's any variations in the findings that we found with the students, because from students they become professionals. And at the end, as we mentioned, behavioral medicine and behavioral sciences is a broader field. We want to take it forward of psychology and the relevant medicine into anthropology and sociology to see if we can find broader insights to work on. And to conclude our study, medical students show higher emotional stability but lower empathy. While psychology students have higher empathy but lower emotional stability, leading to a greater burnout risk. So this essentially talks about we need holistic interventions that would include resilience training, stress management, curriculum adjustments, which helps them balance their emotional well-being and professional competence. I would like those are the references, and we would like to thank chairperson, panelists, and all presenters for their patience and time.
Thank you very much, Stuti. That was an insightful presentation. Thank you very much. Vaishnavi P, are you here with us?
Yes, ma'am, I'm here.
Yes.
Can I put my
Now,
screen?
I request Ms. Vaishnavi P to please share her screen with us. The title of her presentation is The Mediating Effect of Self-Concept Clarity in Social Media Addiction and Anxiety Among Young Adults. Over to you, Ms. Vaishnavi.
Thank you, ma'am. Good afternoon, everyone. I'm Vaishnavi, a second-year MSc Psychology student at Christ University in Bangalore. Firstly, I'd like to thank you all for this opportunity. A small clarification, the title that Visa ma'am had mentioned, that was my original title. I'd made slight modification. Today, I will be presenting my study titled Exploring the Relationship Between Social Media Addiction, Self-Concept Clarity, and Social Anxiety Among Young Adults. Self-concept clarity is crucial for psychological well-being. It refers to how clearly and consistently individuals perceive themselves. Higher self-concept clarity contributes to higher self-esteem and lower levels of anxiety and depression. When individuals have a strong and stable sense of self, they are able to navigate stress better, form healthier relationship, and also maintain resilience during challenges. On the other hand, low self-concept clarity is associated with psychological distress, instability in identity, and difficulty in building stable relationship. Understanding self-concept clarity is particularly important for young adults because those who are in that critical phase of identity development. The rise of social media has introduced new challenges to maintaining a stable self-concept. While social media provides opportunities for self-expression, it also brings pressures to manage curated online identities. When individuals receive positive feedback, it boosts their self-concept, and when they receive negative feedback or inconsistent feedback, it leads to self-doubt and even identity fragmentation. Excessive social media use often increases dependence on external validation, which can undermine self-concept clarity and impact overall mental health. So my study aims to explore how social media addiction influences self-concept clarity and contributes to social anxiety among young adults. Coming to methodology, this is a correlational study. Responses collected from young adults in the age group 18 to 25 from Bangalore using convenience sampling. Data was collected via an online survey using Google Forms. Analysis included descriptive statistics and Pearson's correlation using Jamovi. The tools that were used here, one is Bergen Social Media Addiction Scale. It is a 6-item scale assessing compulsive social media use based on salience, mood modification, tolerance, withdrawal, and conflict, and also relapse. The second tool used here, Self-Concept Clarity Scale. It's a 12-item scale measuring the stability, consistency, and clarity of self-concept. The third tool, Social Interaction Anxiety Scale, a 20-item scale assessing discomfort and avoidance in social interactions. These are the results from the study. Keeping in mind, these results are preliminary as the data collection is still ongoing. So far, I've collected 31 responses. The results show a negative correlation between social media addiction and self-concept clarity, a positive correlation between social media addiction and social anxiety, and a strong negative correlation between self-concept clarity and social anxiety. So interpreting from the preliminary findings, I find that excessive social media use is linked to lower self-concept clarity, suggesting that reliance on external validation can destabilize identity. Higher social media addiction is associated with increased social anxiety, highlighting mental health risks. A stable self-concept may protect against social anxiety. It can act as a buffer, as indicated by the significant negative correlation between self-concept clarity and social anxiety. Coming to the implications and limitations, promoting mindful social media use could enhance psychological well-being. Interventions focused on improving self-concept clarity may reduce social anxiety. Integrating digital literacy and mental health education in schools and communities could make a huge difference, especially amongst teenagers and young adults. However, the small sample size and convenient sampling limits generalizability. As a correlational study, the research does not establish causation between variables. Also, self-reported measures may introduce biases. So for further research, I would recommend a larger and more diverse sample, which is needed. In conclusion, this study offers a preliminary insight into how social media addiction influences self-concept clarity and social anxiety amongst young adults. As social media is an integral part of modern life, it is crucial to develop interventions that promote mindful use and strengthen self-concept clarity to support mental health in its digital age. Thank you all for your time and your attention.
Thank you very much, Ms. Vaishnavi. My apologies that I would like to let everyone know that she had informed prior, but because of the last minute changes and because a lot of messages are coming in the personal text, it is not possible for us to make all the last minute changes. I request all the other participants, if there is any changes that are to be done while announcing, please write it in the common chat box, because there are other people the common chat box. I request that to everyone. All right. Is Shagun Katoj here with us? Shagun Katoj, are you here? Okay, moving on to the next presenter, Joyanne.
Hello. Am I audible? Yeah, I'll just share my screen.
Yes, you are audible. Yeah,
okay.
Yeah, please go ahead.
Excuse me. Please do not leave the meeting even if your presentation is done. Please cooperate with us.
Is my screen visible?
Yes, yes.
Yes, go ahead.
Okay. Good evening. I'm Joanne Khoshravi, and my research is on navigating caregiver burden, the interplay of resilience, life satisfaction, and psychological distress among family caregivers of geriatric patients with mental disorders. I'm a second-year student of MSc Health Psychology from Christ University, Bangalore. So, caregiving for elderly patients can be particularly a demanding responsibility, particularly the one with, mental disorders. So, caregiving can be seen as an act of compassion or it is seen as an act of burden, which could lead to burnout, role strain, psychological distress. So, occupations, financial stability, and work flexibility. These three factors can influence the caregiving roles. When it comes
Is there any connectivity issue, Dr. Nilamji?
degenerative disease. Hello?
Is there any connectivity issue? I can't hear you.
Am I
Yes, it
audible
does.
now?
Yes, you are.
Yes,
Now, yes.
Okay.
audible.
Okay. So as I was saying that resilience could be, positive coping strategies like problem solving, seeking emotional support, acceptance, which is associated with a lower psychological distress. When it comes to life satisfaction, it is a caregiver's sense of fulfillment, social support, and ability to maintain a meaningful life outside the caregiving role. So, caregivers with a high satisfaction have stronger emotional resilience. In a study by Triana in 2001, it has been said. So, my present study, it aims to explore the relationship between caregivers' occupational roles, resilience, life satisfaction, and distress. Basically, it is to examine the well-being of caregivers and the factors to which contribute to their ability to navigate their challenges as a caregiver, and it could help to build interventions in the future. Coming to methodology, so the study was conducted between May to September 2024 in India after getting ethical clearance from the IRB board. It was conducted on primary caregivers of elderly patients who have been diagnosed with mental disorders. A snowball sampling technique was used. I could gain data from 120 caregivers. 84 of them were females, 37 were males. 39 were between 50 to 59 years old, 67 were aged 40 years or older, which shows that caregiving responsibilities are more common among middle-aged and older individuals. I also analyzed other demographics wherein the mother, son, and daughter caregiving relationship was very predominant. And also, mostly caregivers had an annual family income of 10 to 50 lakhs. So, as we know, financial strain could also affect the caregiving roles. Moving to the procedure. Um, so, I did initial contact was through online and in-person mediums through an online survey questionnaire, and a written consent form was also taken from the caregivers. So tools. I use the psychological distress to measure the Kelser psychological distress scale was used. Then satisfaction with life was measured with satisfaction with life scale, and which is developed by Diner et al. And resilience was measured with brief resilience scale, which is a 5-point Likert scale. Also, socio-demographic response sheet was circulated to collect the details of caregivers and elderly patients. Coming to I will be discussing the statistical analysis here. A Shapiro-Wilk was conducted, which indicated that the data on satisfaction was not normally distributed, but I used the box plot way to make the data normal. And then moving on to a correlation matrix. So the correlation analysis showed that there is a weak negative correlation between satisfaction with life and psychological distress. And there is a moderate negative correlation between distress and resilience. There was no significant correlation between resilience and satisfaction with life. I also did a chi-square test of independence, which indicated that there was a association between occupation of the caregiver and diagnosis of the elderly patient. Diagnosis, however, had no association with gender, education, and relationship of the caregiver and the patient's gender. And lastly, I also did linear regression, which is senior, and it showed that resilience was a significant predictor of psychological distress, but satisfaction with life was not a significant predictor of distress. Coming on to the discussion of there were 4 key findings. First was occupation and diagnosis of the patient, such as dementia and Alzheimer's, had a association. It implied that caregiver occupation has this association with diagnosis. This could be because certain jobs provide flexibility, financial stability, psychological association, which could help caregiver to manage their stress. Also, caregiver employed as a healthcare professional has more information about how to manage their stress effectively and cope with burnout. Second was resilience and psychological distress had a negative relation. So caregivers with higher resilience experienced lower distress because they were better equipped to manage their stress. It could be because of coping strategies like problem solving, seeking emotional support, etc. Third was that there is a negative relationship between satisfaction with life and distress of caregivers. So caregivers who are more satisfied with their lives tend to experience lower distress, because a strong social support and emotional support also could play a role in this, a contributing factor. And then lastly, my fourth key finding was satisfaction with life. Even though it showed a weak negative relationship, it was not a predictor of distress. However, resilience is a significant inverse predictor of distress of caregivers with elderly patients with mental disorders. Finally, coming to my conclusion. So basically, we talk a lot about caregiving burden and, it is a lot and what can we do about it. So this research was a small step to spreading more awareness and research in this niche topic called caregiver burden. And it could maybe lead to more interventions which could be developed for caregivers, such as resilience is a key factor, as we found out. Satisfaction of life is a lesser predictor than resilience. It could lead to development of workplace policies, also stress management, psychological support, and future research, intervention programs, public health initiatives, and lastly, improved care quality. Because if caregivers are,
Time is
not
you
not
conclude.
okay. Because as we know, if the caregivers are not burnt out, then it could lead to better treatment for the patients also. So thank you.
Thank you so much. That was a very informative presentation. Thank you very much. All
Yeah.
right. Now,
And
our next presenter is Miss Shreya Jana.
Yes,
Are
ma'am.
you here with us? Yes. While you are sharing your screen to other participants, I will
Hello, am I audible?
things that the titles that you had submitted to us are the same. Am I audible? Am I audible? Am I audible to everyone?
Yes.
Yes.
Yes. All right. This is a request to all the participants once again that the titles that you had submitted to us, even in our last presentation, it is not matching with the last title you had submitted, and you are presenting on a different title. It is making it very difficult for us to make the last minute changes. So I request you to kindly adhere to the same titles that you had submitted, the same presentations. All right. Last minute changes, or else inform us a few minutes prior. Now, and also requesting the participants who have already presented to kindly stay with us in the presentation and not leave the presentation till the end. It is a request. All right, I'm so sorry, Shreya. Now you may share your screen and begin the presentation.
Am I audible?
Yes, you are.
Hmm. Uh, my screen, my screen is visible.
Yes, it is.
Okay. Good afternoon, everyone present here. I am Shreya Jana from Amity University, Noida. I'm going to present on the topic a systematic inquiry into obsessive compulsive disorder, revisiting the clinical picture. Introduction. OCD is chronic psychiatric disorder marked by intrusive distressive thoughts, obsession, and repetitive behaviors or mental acts, compulsions aimed at reducing anxiety. Obsession and obsession and are persistent, unwanted thoughts, images, or urges that cause distress, while compulsions are repetitive actions. Etiology. OCD involves CSTC circuit dysfunction and serotogenic dysregulation, shaped by maladaptive cognition, conditioning, and environmental triggers. Genetic and environmental factors influence its onset and severity. Treatment. Psychotherapy, such as cognitive behavioral therapy, especially exposure and response prevention (ERP), and medications such as SSRI, used for symptoms management. Next, methodology. This review draws from 24 researchers under PubMed, PsycInfo, and Google Scholars, prioritizing peer-reviewed articles from last 2 decades. It includes studies on OCD mechanism, treatments, and psychological factors, while excluding non-peer-reviewed or non-empirical research. Research gap. Key research gaps in OCD include incomplete understanding of its neurobiological mechanism, a lack of longitudinal studies, and limited generalizability due to small and homogeneous samples. Next, findings. The findings are categorized into 5 clusters. Firstly, neurobiological and neuroscience. OCD is linked to frontolimbic dysfunction and atypical visual processing and impaired emotional regulation. Early life stress increases neurobiological vulnerability. Lesion studies confirm connectivity disruptions, while cardiac disturbance exerted symptoms, highlighting sleep roles dysfunction. Treatment and interventions. OCD treatment incorporates yoga for stress reduction, digital tools for symptoms monitoring, and ICBT through dropout rates remaining a challenge. Visual reality assisted avatar therapy aids exposure, while distress tolerance and tailored pediatric treatments improve resilience. Nextly, psychological and psychosocial aspect. OCD impacts psychological and psychosocial well-being worsened by COVID-19, especially in parents and children. CBT aids emotional regulation while magical thinking OCD present distinct pattern. OCD influences economic decisions, increases risk abbreviations, and linked to cardio-metabolic disorders. Maladaptive daydreaming and emotional dysregulation further mediate symptoms, emphasizing the need for targeted therapies. Technology and digital health. Technology is transforming OCD diagnosis and treatment. mHealth and smart trackers enable real-time monitoring, while internet-delivered CBT offers rare accessibility therapy despite dropout challenges. AI-driven digital therapies and e-health tools provide personalized interventions. Virtual reality assisted therapy uh, enhances exposure and responses prevention, ERP, improving engagement and accessibility. Lastly, OCD in specific population. OCD varies across population due to social, psychological, and biological factors. COVID-19 highlighted contamination fear in parents and children. Women with magical thinking show distinctive patterns. Pediatric OCD requires early tailored interventions, while personalized treatments improve outcomes. Next conclusion, understanding OCD requires integrating genetic, neuroimaging, and environmental factors to refine neurobiological models. Longitudinal studies can clarify the impact of early life stress on neurobiology, informing targeted interventions. Advancing AI-driven therapy, VR interventions, and digital engagement strategies can enhance treatment efficiency. Examining cultural, gender, and socio-economic influences ensures more inclusive, personalized care. Additionally, inve- investigating OCD's link to cardiometabolic disorders supports integrated health approaches. These are the some references I used. Thank you for listening.
Thank you very much, Shreya. Thank you. I request Bharti Vijay Purswani to please share her screen and start with the presentation.
Yeah. Am I audible?
Yes, you are audible, and we can see your screen.
Hello. Yeah. Great.
Yeah.
Go ahead.
Yes. Yeah, so my name is Bharti and I'm a research scholar. I'm doing my PhD under the guidance of Dr. Nilesh Thakre from SNDT University. So the title of my study is Binge Watching Among Youth, Big Five, Social Alienation, Psychological Escapism. So moving ahead, binge watching is a recent phenomena which says like one, if you want to watch one and there's another episode and more episode. So it's a recurrent episodes of an intensive consecutive practice of watching web series for 5 and more than 5 hours in one setting. And this behavior is occurring for like 4 weeks and more than that. And there is another factor which is called Big Five factor, which has been given by the personality structure, which is given by the John and Srivastava, which has openness, consciousness, and extroversioness, agreeableness, and neuroticism. And there's another factor called variable social alienation, which was given by Dean. So alienation specifically has three dimensions. One is the powerlessness, which has the sense of controlling, no control in work and the environment and the purpose of life. And then has normlessness, they do not have the sense of subordinating and following the rules. And the other one is isolation, just being away from the world. And then the other variable which I have is the psychological escapism, which was given by Stenson, which is a dual model. self-suppression is more of aiming to avoid the negative emotions, and wherein the self-expansion is motivated by gaining new experience. And the objective of my study is like, since binge watching affects personality factors differently, so my study examine the impact of personality factors on social alienation and psychological escapism among the binge watching youth. So these are the literature review wherein studies have been done. And so this is my variable. I have a predictable variable, which is big five and five sub personality factors, and dependent variable, social alienation and psychological escapism. So these are my hypotheses. The first is there will be a significant positive correlation between the big five factors of personality and social alienation among binge watching, and same for the psychological escapism. And the other one is the five factors of personality will significantly positively predict the social alienation among the binge watcher youth, and same for the psychological escapism. Moving forward, in my methods, the participant actually have given to 750 participants, wherein I have figured out 421 as a high binge watchers. So among those high binge watchers, after nullifying the outliers, I got the participants of 333, wherein 165 were the male and 167 were the females. And the and the inclusion was 18 to 35 years of age, and people were from the Mumbai and high binge watchers only. And my sampling was purposive and snowball sampling. Tools I have used is binge watching symptom scale, which was developed by Thackeray and Purswani, and the Big Five inventory by John and Srivastav, and Being Alienation Scale and Escapism Scale by Stenson. And my research design is non-experimental, exploratory design. I have done the correlation analysis and the multiple regression. And procedure was I have been informed the authorities, and consent was being given, and then tools were provided to them, and debriefing was done at the end, and they were screened as high binge watchers. And these are my results. So this is the correlation matrix wherein it shows the social alienation has a positive correlation with openness, and agreeableness and psychological escapism has the same openness and agreeableness.
Kindly wind up your work.
All right. And this is the multiple regression which I have done, which also shows the openness has the significantly predicts social alienation, and psychological escapism is predicting the psychological escapism. So these are my findings wherein the openness and agreeableness are predicting the social alienation, which has been supported by some of the studies like I have mentioned here, Stegner, in which it says that the people who are more open, they will be exploring, and at the end, there is a chance that they get into the isolation if they are not able to kind of fulfill their high level of fantasizing world, and they can lead to the social alienation as isolation. And the other one, sorry, yeah, and the same for the
Is up. Kindly.
all right. All right. So the implications are to develop the effective intervention and awareness program, and to develop a healthier media consumption. Yeah. Thank you so much.
Thank you very much. Now, I request Jyoti Sethia. Kindly share your screen.
Yes, ma'am.
Yes, ma'am, I'm sharing.
Yeah, all right.
Is my screen visible, ma'am?
We cannot see your presentation, but we can see your screen.
The presentation is not visible. Okay.
No, we cannot see your presentation. Yeah. Astha Singh, are you here with us until Ms. Jyoti is figuring out her presentation? I would request Astha Singh, are you here with us? If you're here with us, please raise your hand. Okay, Astha Singh is not here with us. Ms. Jyoti, kindly hurry up.
Yes, ma'am.
Jyoti, is there a problem?
Ma'am, I'm able to share my screen. May I try again?
Yeah, you can.
Ma'am, your voice. Ma'am, you're not audible.
In the WhatsApp group, there's someone called Daman on our side. But if you can, are you in your PPT? Yeah, we can see. We can see your screen.
Ma'am, is my presentation visible now?
Yeah, your presentation is visible now.
Okay, ma'am. Okay, ma'am, I can do something.
You can start, Jyoti.
I am visible.
Your
All right. Good evening, everyone. My name is Jyoti Sethia. And yes, ma'am.
Your screen is not visible, Jyoti. Like your presentation is not visible, I mean.
Oh, okay.
Please
Ma'am,
check.
I've shared my PPT. I have shared my PPT on
It's
the mail
visible
ID.
now. As of now, we can see.
The presentation is visible. Yes, ma'am.
Jyoti, kindly check your network connection. Jyoti, am I audible?
Yes, ma'am. Yes,
Yeah,
ma'am.
kindly check your network connection because we cannot see your screen.
Okay, ma'am.
And we have
I'm just
limited
doing it, ma'am.
time.
Yes, ma'am.
Yeah.
Now is it visible? Yes, ma'am. Now is it visible? Yes,
Yes,
ma'am.
it is visible
Now
now.
is it visible?
Kindly start and kindly adhere to the topic. Yes, it is visible.
Yes,
You
ma'am.
can start.
Okay. Thank you, ma'am. Thank you so much. Good evening, everyone. My name is Jyoti Sethia, and I'm doing my PhD currently under the supervision of Professor Das Gupta, ma'am, University of Calcutta. The title of my presentation today is Role of Perceived Creativity, Cognitive Flexibility, and Sustained Attention Phone Use Among University Students of Kolkata. Now, we all are aware about smartphone use and how this smartphone use has become an addiction among majority of people in India and outside. So there's a research finding which says, as per Silver 2019, smartphone use has excessively increased among younger generation under 35 years of age. And the reason for smartphone increase, there are lots of factors which increases the smartphone use among these people. The majority of the population, which is under 35 years, this is the main reason I've taken the age group 20 to 25 years who are currently doing their masters and graduation studies universities in Kolkata. Now, since pandemic, we have seen the addiction has increased considerably as per Mason 2022. And smartphone use can definitely impact community health and mental well-being in many, many different ways. So it becomes imperative to understand what are the factors which predict smartphone use. And as we get to know the important factors, we can use that information to plan our intervention and training, which will effectively help us to minimize the negative impact on the young generation of India. Moving on to the methodology, I would like to mention that the study which I'm conducting currently, the data collection is still ongoing, and my aim is to complete at least 400 students in Kolkata. The technique which I've used for data collection is the probability sampling method, stratified sampling method. In this, I've approached I've selected universities from a lot universities present in Kolkata, and I've visited them personally and asked them to fill up the Google form. So it was stratified random sampling method. And here for this study, I would suggest, I would say that this is a preliminary correlation study which I've done till now on 100 students, 50 male and 50 female students of University of Calcutta. Now, in this study, I have used smartphone use, which is my criterion variable. This would be measured by the smartphone use scale, and variables are sustained attention, which is measured by attention control scale by Berry 2002. Perception of creativity, which is measured by Creative Styles Questionnaire, Kumar and Holman, 1997. And cognitive flexibility, measured by Cognitive Flexibility Inventory by Dennis and Van der Waal, 2010. Now, moving on to the results which I have gathered now. The study significantly shows that there is a good significant relationship between sustained attention and cognitive flexibility, which is also supported by the previous research findings. The study also points out that sustained attention and smartphone use is significantly correlated with each other. And I'm still working on the topic, as I mentioned, to replicate the study onto a larger population. The population 400 students, 200 male and 200 female, based on the positive results I've gathered from the smaller population. And lastly, I would also mention that sustained attention, which was found to be significantly related with smartphone use, it has also been found as a significant predictor. And the implication of the study is smartphone use is increasing day by day and has a lot of psychological impact on all of us. Knowingly, unknowingly, we are doing harm to our own health, and people around us are also doing the same. So understanding the factors that predict the smartphone use will help us better plan the intervention and training so that we can minimize the negative impact on the younger generation. And with that, I would like to wind up my presentation. Thank you all the panel members. Thank you all the participants. Thank you, Amity University, to give us such a wonderful opportunity to present our findings here online. Thank you so much.
Thank you very much. Thank you so much, Jyoti. Now, I request our chairperson, Professor Dr. Gauli sir, to kindly give us his feedback about the session and his words of wisdom to all our participants. So, over to you.
Yeah. Okay, good evening to all of you present here, all organizer, Dr. Visa, Dr. Nalima, she's there? Nalima?
Yes, sir. Neelam Bansal.
Oh, sorry, Dr. Neelam. Yes. Okay. It's a wonderful experience which I had all students from various universities. They presented their work here, and we could understand that how different psychosocial perspective they have used to understand human behavior. And I think many of them have covered many aspects of spirituality, religiosity, even Indian psychology, variety of papers. Of course, and that was a really learning experience to all of us and students coming from various parts of this country, from Calcutta, Mumbai, Bangalore. I could see well prepared presentation guided by their own teacher and independent work group work actually. So it was really a very nice experience, and I must appreciate that. See, once we, particularly in developing country, when we have to understand human behavior, it is not only from one perspective, but psychosocial, economic perspective also are equally important in developing country like us. Because once we incorporate different psychosocial perspective to understand human behavior, particularly in developing country, I think that particular aspect some of you have covered, but some of you need to work on that aspect also. When you are working on your research, it is better to even incorporate some of these psychosocial factors which matters a lot in Indian context. Okay. So with this, I congratulate all of you without taking much of your time, because I know that we started, so it was around 15, 16 presentation. Okay. So
Yes.
I congratulate all of you. Wonderful presentations. Okay. And thanks to Amit University Lucknow for organizing such an event which involving students from different part of this country. Okay. Thank you so much.
Thank you very much, sir. Okay. Thank you very much, sir,
Thank you.
for your blessings. Okay. Over to you.
Now, I request all the participants, our chairs, our chairperson, our co-chair, everyone present here to please turn on your cameras. We will have a photograph right now. We will have a photograph. Once we click the photograph, I will extend my vote of thanks. I request every participant to please turn on the cameras. And we can all smile, have a smile on our faces for a picture. Can we do that? Yes?
Thank you.
Yes, all the participants have turned on their cameras. Most of them have turned on their cameras, as I can see. All right, whoever. All right. Thank you very much. Now, it is my privilege to extend a heartfelt vote of thanks. At the conclusion of this insightful session, I would like to sincerely thank Professor Dr. Gautam Gauli for sharing his immense knowledge and his expertise with us today. His thought-provoking insights have truly enriched our understanding and sparked a meaningful discussion at the end. Also, thanking our wonderful participants for active participation and very keen engagement with us. Your presence and enthusiasm have made this session even more valuable. Also, lastly, I express my gratitude to the organizing team and everyone behind the scenes who made this event possible, including Damanpreet and Krishleen as repertoires for this event. Let's continue to learn, collaborate, and apply these insights in our work and lives. Thank you all. Have a very great evening ahead. Thank you so much. We all can leave the link now. Thank you so much. We all can leave the meeting. Thank you very much, everyone. Bye-bye.